All right. Well, good afternoon. Welcome back, everyone in the room and also on Zoom. I'm very happy to introduce you to our afternoon. We have two more events this afternoon. First is our panel here led by Dr. Kravitz. Then we will hear from the editor-in-chief from JAMA. And for those of you who are here in person, we will have can I call it a happy hour? Sure. A reception at the end. So let me introduce you to Dr. Rich Kravitz. He is a professor of general internal medicine and the former director at the UC Center Sacramento.
Hi, everyone. Thanks for joining us. Thanks for coming back after lunch. This morning we heard from a group of researchers working at the ground floor, as well as a group of policymakers. And I think I've been tasked with highlighting a few key themes from the morning, so see if my list matches up at all with yours. First, we heard about the ABCs of science to policy: accountability, best evidence, and collaboration. A recurring theme that's related to collaboration is the importance of trust and relationships in moving science into policy. Establishing credibility is a big part of getting listened to. We heard from Secretary Becerra about the importance of awakening to the problems of real people and staying awake to them. We heard about the tension between researchers as advocates and researchers as honest brokers, and heard some hints about how to maybe become honest brokers ourselves. And finally, we heard about how it's not sufficient to simply be an objective analyst or data jockey, but to synthesize the information for policymakers so it can be put to best use. Well, now we have a set of panelists from both sides of the divide, many of whom have actually worked both in science and policy, and we'll see whether we can get their help in understanding how to bridge the gaps. First, moving from my left to right, we have former Chief Justice Tani Cantil-Sakauye, who is currently Executive Director of the PPIC, Public Policy Institute of California, right? Then Evan White, who is the Northern California or Berkeley Director of the California Policy Lab. Amy Gilson, who is Deputy Director for Legislative and External Affairs at the Office of Environmental Health Hazard Assessment. And if I can say the acronym correctly, it's WEHA. OEHA. Left out a syllable there. And finally, Katie Heidorn from the California Healthcare Foundation, where she serves as Deputy Director for Legislative and External Affairs. So I thought maybe we could start out by just having the panelists introduce themselves and say a little bit about how they got to where they are and what their current role is and what their organization does and how that relates to the dissemination or translation of evidence into policy. So maybe we'll start with you, Tani.
Thank you, Dr. Kravitz. It's a pleasure to be with all of you and to be on this distinguished panel. I thank you for the invitation. I am currently the CEO and president of the Public Policy Institute of California. It's a nonprofit, nonpartisan charitable trust think tank with over 8 different areas of research, including the safety net. So while we straddle both San Francisco and Sacramento, the majority of our work is in San Francisco with legislative leadership, constitutional officers, and also municipal governments, because we work on the data. We consider ourselves the trust brokers. We consider ourselves with our reports, our research, our videos, our fact sheets, our policy briefs about the data and the analysis as it informs and improves public policy. From anywhere from criminal justice to water to the environment to the economy, to understanding California's big trends, safety net, TK-12, through higher education and on. We're 85 people strong. The majority of us are researchers, and we've been in existence for 31 years. We're one of the longer standing, old, independent, because we take no money where any donor hopes to have a specific outcome. That puts us directly in, I think, pertinent to the conversation we're going to have today about challenges. Prior to PPIC, and I've been at PPIC about 2 years and 8 months, I was the Chief Justice of California, and I headed the judicial branch of government, and I ran policy across all boards for evidence, for incarceration, for fines and fees, for diversity, for access. I was also head of basically the state bar, admission, education of lawyers in California, and also oversaw retired judges' policy, sanctions, and also the Commission on Judicial Performance and Appointments there too. In addition to that, I sat and carried the same caseload as every member of my Supreme Court for 12 years. That's the 12-year term of a Chief Justice in California. Prior to that, I was 20 years on the bench, 14 years as a Superior Court judge, trial judge, and 6 years at the Court of Appeal in California. That's an error correction court. And prior to that, I was a lawyer. And now that I've retired from the judiciary, I am a lawyer once again. But that's what I want to speak to. PPIC was a calling for me because as a judge, as a lawyer, I was always only interested first and foremost in the data that revealed the facts. Because we can't do justice in this world, nor can we have important policy about any subject matter until we have the facts, until we have the data. And like the courts, PPIC lets the data and the facts speak for themselves. And as a result of being nonpartisan, our work is across the aisle. We are in the Republican caucus, we are in the Democratic caucuses. We are there to provide legislative leadership the information they need in the policy committees that they want. I am regularly in the legislature pushing our reports that are based on data, if we can get it. And that's a challenge, quite frankly, getting it today. We'll talk a lot about that. But we also partner with others in trying to bring around events that inform the public as well. Let me say that there's, to me, a very strong connection to the judiciary and to policy, because what is policy but really a manifestation of the law? And I've been on the receiving end of laws that do not work, because the policy was never originally meant or really had a robust background for research that informed it. So I'm really happy to be at PPIC in a place to try to influence policy before the law is made. So thank you for allowing me to be here.
Evan?
Nice to see you all. My name is Evan White. I'm the Executive Director of the California Policy Lab. We are a research institute that's based at the University of California. We have offices at UCLA and UC Berkeley, but we work with all of the campuses at UC. And we do all of our work in partnership with government agencies within the state of California. So both at the state level and at the local level, we work in partnership with government using the data that they're collecting to better understand the policies and programs that they're delivering to folks. So we do a lot of work with highly restricted, sensitive, person-level administrative data. And we do, as a result of that, we do a lot of work that links data across different agencies within the state or within different departments within a given county. And I often find it's helpful to give a couple examples. So one example that we've worked on for several years is work to try and get more folks onto benefits that they qualify for. So often an agency like the Department of Social Services only see who's enrolled in their programs. They don't see who isn't enrolled and who's eligible. But we have other data sets from other agencies who can show that. And so we've worked both with respect to programs like CalFresh or the SNAP program, but also things that are delivered through the tax system, so earned income tax credit or stimulus payments during the pandemic, the child tax credit, again, during the pandemic. We sort of worked on a whole host of projects to estimate the take-up, the eligibility for those programs and the take-up of those programs, and then working with counties or other delivery agencies to try and do outreach to get more folks onto the program. So that's one example that we've done. Another project in the local level, We are using linked data in the county of LA to, including through the health system and the mental health system, to better predict who is most likely to become homeless over the coming year. And then we provide that risk list to the county, who does affirmative outreach as part of a new unit called the Homelessness Prevention Unit that, that reaches out to folks who are most likely to become homeless and offers them several services, but most often a short-term rental subsidy to try and prevent them from becoming homeless. So it's just a flavor of the type of work that we do. We do work, both our own work, and then we also end up being kind of an administrative data hub for California in some ways. So we do work with over 200 different researchers around the country. Most of them are at UC, but not necessarily. We work with about 60 other universities, or faculty from 60 other universities who want to do work that's sort of policy focused and using California's administrative data to better inform evidence and policy. A bit about my background, since you asked me to talk about that. I'm also trained as a lawyer like Tani. I just have a much less fancy resume. I did work for a brief time at the California Supreme Court, but it was a less prestigious job. And I also, importantly, was a teaching assistant with Scott and Carolyn, who were on the panel earlier. So those are the things that I'd highlight from my past. But no, I worked in federal government for a while, and also worked in anti-discrimination work for a long time at the local level. And so I come to this work from my government side. I'm not trained as a researcher. I don't have a Ph.D. I work with a bunch of folks who can sort of understand the Greek letters part of the research, and part of what I'm helping them to do is translate it for policy audiences and make sure that we're choosing projects that are actually going to sort of have an answer to the question of, like, well, what's going to happen because of this? What change is going to happen as a result of this project? So that's a bit about me and about the Policy Lab.
Great, thank you. Amy.
All right, great to be here today. Thanks everyone for sticking around after lunch for this awesome panel, and thanks to Rich for putting this panel together and the organizers. This is such a beautiful space. I've never been here before, but I hope it's not the last time. I'm Amy Gilson, the Deputy Director for External and Legislative Affairs at the California EPA's Office of Environmental Health Hazard Assessment, or OEHA. Yes, yes. I see that with enthusiasm. OEHA, yeah. Now you'll remember. And OEHA is one of the 6 branches of the California EPA. We like to call ourselves the science branch of the Cal EPA because we're not out there regulating, we're not making grants, we're doing the science so that our partner sister departments can do their work grounded in rigorous scientific evidence and data. We're about 150 strong, mostly PhD level scientists, a lot of toxicologists, because what we're focused on is all the stuff in the environment that can make you sick. So there are tens of thousands of chemicals in commerce or that occur naturally, and we're trying to understand, which of those are hazardous, at what levels, how do you protect people, what's effective to protect people from those chemicals. And then those get baked into chemical assessments that are used by the Water Board in setting drinking water limits for contaminants, by the Air Board in reducing levels of toxic air contaminants. And then we also are looking at other environmental hazards like heat, right? One of the most underrated weather-related killers out there, kills more people than other climate-related hazards, but you don't necessarily notice it. It's not as dramatic as other weather events. So we pull together multiple streams of data into really action-oriented data tools like CalEnviroScreen, which helps identify communities that are burdened by multiple forms of pollution and where, due to socioeconomic factors, underlying health conditions, they're more susceptible to that pollution. So very much in the mission of doing science to inform policy, very much aligned with what this is about. And what that looks like for us and when we're driving impact is, Cal and Virus Screen has been used to invest almost $7 billion in the communities that need it most. Or, our assessment on diesel that helped kind of pave the way, the scientific way for regulations, has helped result in an 80% drop in cancer-related, diesel-related cancer risk, right? So these are driving real impacts for people. In terms of where I come from, so way back, I was really interested in policy, and I thought I was going to, go study, history or social sciences, and I felt like it was hard to find a fact you could really hang your hat on, right? It turns out society is very complicated, and so I was like, you know what, I'm gonna go, maybe I'll be a doctor or something. I took chemistry, and I just loved chemistry. It gave me a new way of thinking about the natural world. It gave me facts I felt like I could really hang my hat on. But when I was in graduate school for chemistry, I was kind of like, this is weird. Like, why are these facts that I think are so solid not so compelling to other people, right? Why aren't people believing in climate change, right? Why the vaccine hesitancy? And so this brought me back around by being curious about how science actually translates to how people think and believe and how it can actually drive action. So I was very, very fortunate to make the jump to working in policy after I finished my Ph.D. Through a fellowship program that there's a couple other people in this audience I know who have benefited from it as well. Whoop, whoop, yeah. The California Council on Science and Technology Policy Fellowship. I worked for several years in the California State Legislature, starting in the Assembly Committee on Environmental Safety and Toxic Materials, and working in several other capacities there. Then I worked as an environmental advocate for a nonprofit. Environmental advocate is a kind of code for I was a lobbyist. And then I was very lucky to have the chance to come over to a WIHA, which for me is sort of a dream job, right? Because it combines working a lot with science, thinking about science, but in my capacity as doing legislative affairs, I'm translating that for the legislature and for the media and for the public. It's a great time to be doing this in California because California is still really dedicated to the science, and as you're hearing from many of us today, we're steadfast in using science to inform and drive policy. So I feel very fortunate to be here and thinking about this with all of you.
Thanks, appreciate it. Katie?
All right, thanks. Last but not least, I'm Katie Heidorn. I'm the Director of State Health Policy for the California Healthcare Foundation. So as you can tell from our name, we are focused specifically in health and the healthcare delivery system. So not direct to consumer, but we are really focused in making the healthcare system better for people with lower incomes in California. So that includes access to care, that includes behavioral health, that includes making sure that the workforce is culturally competent and in the right places to serve the right people at the right time. That includes coverage, which I know is a huge topic, and you heard people talk about that this morning. We do so much in that space. So we're a nonprofit philanthropy, and what that actually means is that we give out about $40 million in grants. We have an endowment. We were created about 30 years ago when Anthem Blue Cross of California moved from a nonprofit health plan to a for-profit health plan, and that created both the California Healthcare Foundation as well as the California Endowment, which you also might be familiar with. So the endowment took on the role of the traditional big philanthropy that funds lots of 501c3 community-based organizations. They do a ton of grant making in that space. And then we actually took on the policy space. And so most of that $40 million a year goes out, we do some core operating grants to 501c3s. We typically give those grants to people working or to organizations working in the California policy space, so in Sacramento. And then we spend the rest of that money doing research. I see several of our grantees in the audience today, woohoo! And so that includes academia and that includes consultants, and if you go look at our website, we have myriad reports on everything you can possibly do in a bunch of different policy areas. And I would say our policy audience is a very special audience for us when we think about improving the healthcare delivery system. So very proud of that work. I would say I'm personally, that's my job, is to translate all of that research and make sure that we insert it into the policy process. And that includes making sure that we're listening to our policy colleagues that you heard from this morning, listening to researchers like you who have great ideas, and how do we get that research into the policy conversation, whether it's in the state legislature or the executive branch, or into the hands of stakeholders and lobbyists, who can then take that data and make sure that we're having informed conversations about policy. I would say that that's really been a through line for me through my whole career. I'm really passionate about making sure we all have as much information as possible to make the best decisions. So I'm hearing that theme across all of us, and so I'm really excited for the conversation today. A little bit about me. Amy, I really appreciate your story because mine was very similar, except I didn't get a Ph.D. I'm an Aggie, so I'm really excited to be, woohoo, go Ags, really excited to be at Aggie Square in UC Davis. Today, obviously, we're not in Davis. I was an undergrad there, but it's really incredible to see how UC Davis's presence has grown in the region over the last 20-something years. We won't go back that far. But I started out interested in political science and very quickly also took a class and was like, gosh, this data is so bad. I really gotta take some science classes. And so I took chemistry. It's so funny that you said that. I enrolled in general chemistry and loved it. And then I really loved my biochemistry class. And
I don't think I've ever been on a panel with someone like, and then I took a chemistry class and I loved it.
I loved it. And I took biochemistry. And then I got to upper division, and I really loved, for the scientists in the room, loved the proteins class, in case anyone's really, we can talk about that later. I'm very excited about the lab space that you all have downstairs. When I walked in, I was like, gosh, what a beautiful building. It was like, my lab did not look like that when I was an undergrad. Let's just say that.
Give it 6 months.
Yeah, exactly. Give it 6 months, exactly. But what really got me was that I knew by the time I hit the end of my undergrad career that I was not going to be a scientist. I really liked talking to people and translating the scientific information into places where people would actually understand and have impact. And I also participated in student government, got bit by the government bug, and I've been in Sacramento and in the policy space for about 20 years now. Came over also doing a fellowship program, the Senate Fellowship. And so Scott Ogus and I have the distinction of being the two scientists in our class many years ago, and we had lots of conversations about pipetting when we were trying to do policy in state government. So I spent about a decade in state government in the Senate Appropriations Committee, where I really got my health start. Got to be there when the ACA, when the Affordable Care Act was passed federally, and so got to analyze all of the implementing legislation. And then had the opportunity to go to our California Health and Human Services Agency and help implement the Affordable Care Act. So I was there for 5 years, and then I went into nonprofits and really went from our ivory tower of government all the way down to the community and went, wow, people are coming and telling, I represent people who are going knocking on their neighbor's door to help them enroll in health insurance. So for me, it was a very humbling moment to go, this is the policy that we're making, and this is how it actually works on the ground, and why that feedback loop is so important and so now I'm happy to be in this place where we get to study and listen to people in the delivery system and consumers on the ground, and then take that information back and tell those stories and provide that data to the policymakers. So.
All right. Well, thank you for those excellent introductions. The next set of questions I'm going to address to each of the 4 panelists separately, but please feel free to weigh in with your own thoughts after the initial person has had a chance to respond. And also, audience members can just raise your hands and get a microphone and ask questions in the middle. We're trying to conduct this as interactively as we can. So let's start with Amy Gilson. You, as you mentioned, you spent some time in a chemistry lab, you've worked on the legislative side, you've worked for advocacy organizations, and now you're in the executive branch. So you have an extraordinarily broad perspective, it would seem, on what it takes to successfully translate research into policy. So can you say a little bit about what you think the essential ingredients actually are to accomplish that effectively?
Sure. Well, thanks for that introduction to the question. one thing is to know that it's really important, right? What we're all here talking about is so important because policymakers need and generally want the information to help them make smart decisions and represent their constituents, or effectively carry out the missions of their departments. And with science, you can make what's invisible visible. You can really motivate problems that maybe were not seeming so pressing. You can kind of form facts or cast doubt, right? It's really powerful, and it's really important what we're all here talking about. When you're approaching science to policy translation, one thing you might ask yourself is, what are your goals, right? Do you have a particular policy that you think really should be implemented? Then you might be an advocate, right? You want to go and you want to advocate and find ways to make it possible for that policy to be realized. Or are you thinking, I'm really here to kind of help people know what the data is so that they can make smart decisions, right? Then you're more of an advisor. We heard from Chaburp earlier today about how they are very dedicated to being neutral and just really making the data very clear. That's a really important advisory role that they play for California. Those are both, the advocate and the advisor are both very important and very valid kinds of roles that you might try to play, and it might be different at different times. But if you're, so that's one thing to think about. Another is communication, right? We've been talking a lot about communication, but it can't be stressed enough, just communication. It's something that we don't get trained a lot in a scientific or necessarily like a medical setting, but being able to communicate effectively, through writing and orally, and to listen effectively is going to be important in any kind of policy setting that you are engaged in. So one piece of that is make it as easy as you can for the person you're trying to influence or that you're trying to assist to use that information. So we've talked about like writing policy briefs, right? But then Tani, you were also saying like you are in the offices and you're talking about it, right? You can't rely on them to read it. Like if somebody should really know about it, then you are in their office and you're telling them about it, right? Because that's what everyone else is doing, right? They're hiring lobbyists, right? And their goal, their whole job, right, is to look through, not necessarily in an unbiased way, right, because they're representing their clients, but it's to look through evidence and figure out how to present it in a way that advances their clients' roles, right, their clients' goals. So you want to make it very easy to use the information that you think should be used. Part of that is putting the bottom line up front, right? So if you have a scientific training, you might be starting with, well, here are my methods. Here are the data sources that I used. If you're talking to someone who's super busy, or you want what you're reading to be read by someone who's super busy, you better start with what, your results in one line, their takeaway in one line, and then it's a choose your own adventure. They can read on if they need to. And then finally, think on communication. Think about your logos, your pathos, and your ethos, right? Logos, we're really good at that, right? Your statistics, your logical arguments. Pathos, we talked about that a little bit, right? So what are the human stories that you can bring in, right? Those are two different kinds of evidence streams, really, right? The personal, on-the-ground evidence, and then the statistical, broader, more general evidence. But also think about ethos, right? So we're pretty good at that as scientists and people representing, think tanks and universities. We tend to have a lot of that credibility. But when a policymaker is turning to you, they might not be turning to you or really needing your personal, assessment. It might be that they are looking for kind of what's the scientific consensus on this. And so, organizations like Chaburp or Public Policy Institute or others, Institute for Transportation Studies, also out of Davis, are really important for being able to speak more broadly around what's the scientific consensus. And then finally, just love the work, right? It is a long slog. You've heard about efforts today that have taken decades to manifest. And so you have to have your goals in mind, but also just get into it. The communication is a two-way street. You're also learning from the policymakers what are their data needs, what are their research questions, but also how do the programs work? Because science is very rarely the only thing that is needed to make a smart decision. There's also understanding how government programs are already functioning and how that feeds into it. So it's really a two-way street or a multi-directional street where over time you're kind of learning also about the policy setting. If that seems kind of overwhelming, there are like little things that you can just try, right? Like you're writing an abstract. Put your results in one sentence in the abstract, right? Or subscribe to the listserv of a nonprofit that's doing the kind of work that you want to make a part in. And just those little things are like steps that anyone can take, that you can take to start being effective in the policy world.
Great. Anyone want to add anything from their experience? Katie, I was thinking about you, maybe.
Yeah, just to thank you. Thanks, Rich. Just to add on a little bit, we heard it in the panel right before this, and I know Roz is still in the back of the room listening because she wants to hear everything that you all have to say. If someone asks you, don't be afraid to send an email, right? Carolyn said that their email addresses are literally on their webpage with their phone numbers. People still sometimes pick up the phone and call people. And so, I actually love that advice, Amy. Put that line up in your abstract, but if you just published a paper, send it to that nonprofit. And just say, hey, just wanted to let you know that this is out there. Or I think as Ross said, hey, there was this article on this research that I wrote. Send it in. I mean, I feel like, we've got all these people who gather all of this information, and then when it's time to analyze a bill or analyze a budget opportunity, or when someone says, hey, you have 24 hours to come up with a brilliant idea, then they go in those files and they say, gosh, I remember that this researcher 6 months ago sent me this thing. Believe it or not, they really do. They remember all the stuff. So it can be really easy. There's small things that you can do, and then we can, there's also a lot of other things you can do that are a little more looking at timelines and schedules and sort of trying to anticipate. I think Courtney asked a really great question earlier. How do you, if you're actively working on a topic, how do you get that into the dialogue? In addition to doing those sort of small touches here and there, you can also work with an organization and be a little more active, or meet with those people and build relationships with some of those key committee consultants. I think was that Dawn who said, those are the people that I talk to. Those committee consultants are the people who are in it, and they are the legislature's experts on those topics. And so if you start to build a relationship there, just have a meeting and say, I'm interested in this topic. What's coming up for you? What would be helpful? We know that you can't just snap your fingers and do research. And if you know what's sort of on their mind 6 months from now, you can say, you know what, I'm going to come talk to Katie at the California Healthcare Foundation and see if she has any interest, or one of her colleagues has any interest in funding me to do some research that might have impact in the legislature, because I have all of these other 4 findings that lead me to believe we need to get this into the policy conversation. So you can get a little deeper that way as well.
Can I add 3 things too?
Please.
I think these are all such fantastic. You really need to think about it before you go into a legislator's office. They'll give you about 10 minutes, and you have to be concise and pithy. And so I will say, for me, I always pull who donates to them. I pull all of their interests. I pull their successful bills. I pull their failed bills. I look at their latest bill that's success, because that's always nice to say that you know what they're doing and you appreciate it, or you have a comment because you make it personal to them. So I pull their background information. The second thing I would do too is, when I go in and I know I have 10 minutes at PPIC and I say, look, PPIC, here's the thing that's different about us. We don't want anything from you except your opinion. And then they relax, and then they take notes, and then they laugh, because I'm not asking them for money like I used to always ask for them. And then the third thing I would say too is, on your way, make sure that you follow up with staff. We send a big QR code page. We find out what their member is interested in. Even if we don't do it, if we know the policy lab is doing it, we send it, because we want to be a resource to them, and we offer ourselves in closing. We're a resource. If we don't have it for you, we can get it for you, because we want to be one of their first round of phone calls when they're looking for information.
So Tani, let me follow up with you. You of course mentioned your service as Chief Justice of the California Supreme Court, but before that you worked, among other places, in the Duke Mason administration as legislative secretary. So you've had broad experience in the executive branch, in the courts, of course, and now in a sort of a research to policy think tank. What do you see, what is it about researchers and policymakers that they need to know about each other? They, to some extent, inhabit rather different worlds. And what is it that policymakers need to know about the work of researchers, and what in particular, we've started to explore this, but what in particular do researchers need to know about the world of policymakers?
Thank you. I think those are great questions, and they're very symbiotic, and a lot of it's been covered already with discussion. But I want to say what researchers need to understand about policymakers are, I think, is that a policymaker is focused on a bill in that moment and wants to be an expert very quickly up to speed. And so researchers need to know that all of our reports, 60-page reports, appendices, our policy briefs, our fact sheets, we have to have them nimble and ready. We have to have them so that it can be useful to the member. The member is so busy. The member has so much going on. And so we have to be able to be that voice in the wilderness that catches them that they need. A lot of times I advise, if you're ever looking for speech material, you should go to our website, because you can drop a lot of interesting facts about lots of things of the things we do. But our researchers have to understand, and it's a little bit's been said here, the policymaker does not want you to hear you start with your methodology. They don't care. They want to know the bottom line. The best situation is when you catch their attention, I tell the researchers, and they end up, the policymaker is asking you questions. Because when the policymaker is asking you questions, you're giving relevant information. If you find yourself, researcher, blabbing on, and there is no inquiry, and you need to look at your person, they're not listening, I don't think. They're not certainly ingesting. I mean, it's a very transactional relationship in that moment, and researchers don't understand policymakers, and policymakers need to understand this. For us to be effective as researchers, we need the data. So we're not a state entity. We don't get state data. We have to sign data agreements of confidentiality and who can use it and who can quote it. And we go to the mat. We arm wrestle for this data. And we look at national data. Across the board, we look at state data. County data is almost impossible to find. And we end up having to pay for it, which we're a nonprofit. It's expensive to pay for data. We go to legislators and we say, there should be a bill. There ought to be a law that says this public data in California across all the agencies should be accessible for us to assess what it is and how California is doing. At PPIC, we study 7 specific areas. We didn't just pick them out of the blue. Those are the areas where the governor puts his greatest amount of money in his budget. These are line item budget bill subject matter areas. If the state is putting their money there, that's where their value is. That's what guides us for what we study. But we don't have data. We're constantly, and I won't name agencies, but we are in negotiation with one agency for their data to determine K through 12 performance, which there's a split opinion as they're doing great and they're doing poorly. And so we want the data, but we can't work with a system that says, well, okay, we'll give you the data, but we want final approval on your report. Well, I said, no, we can't engage in that kind of agreement. We can't have someone say, I want those numbers changed. So we don't have that data because we won't agree to letting you edit our final report. We'll certainly share an embargoed copy for you. We will take an honest look if you tell us we're wrong. But you don't get to say, eliminate that data, please. Just could you take that paragraph out? And so for us, what policy needs to understand is we need the data. And they sit on the data, they control the data, and without the data, they cannot be assessed. There can be no accountability without the data. And so it took us years, for example, to get a data agreement with the Department of Corrections, CDCR. And the only reason we got the data agreement from CDCR to study their programs and to study how inmates were doing in the programs and how they were doing once they were left prison and whether they got jobs through EDD is because the auditor did an audit on CDCR. See, I see some recognition, and it was a horrifying, scathing audit of CDCR, and all of a sudden they were willing to play ball, and we could get the data. But the difference for PPIC is we're not a state entity, so we have to go to each agency. So what we find interesting in the data that we tell our policy leaders is, well, this agency will give us the data, but in order to sign the data agreement, we can't share it with any other state agency. So near as I can tell, it's a super secret society of who has the data, and they're not sharing it with each other. But this is public data, and this is data that goes to improve policy for all of California. But the access to it is very, very difficult. And we've tried to raise this with policy. So with policy leaders, it's about telling them what research needs that we think ultimately will result in accountability, better programs, better projects, better access to programs. And for researchers, they just have to understand that, you know, the reading public has an appetite, not for methodology, not for the statistics, but for digestible, understandable, translatable information that they can repeat and everyone can understand. And that's a hard thing to do. It takes a lot of sophistication to do it. And we're constantly trying to get our researchers to drop their researchees and to try to speak in a more digestible way that we think is more impactful.
Thanks. Yeah, go ahead, Evan.
Just say one more thing. Yes to everything that Tani just said. The one thing that hasn't been mentioned yet here today, I mean, lots of things about sort of the timelines are different and the communication styles are different and the depth of focus is different. But one thing that I haven't heard said is, I think maybe it's humility or like from a researcher's perspective, I think they need to understand that the policymaking process can and should be based on lots of other factors beyond the research. And I think that that's very important to understand and not sort of think of, you're sort of caught in your own profession that's focused on research. You think it's the most important thing in the world, but honestly, it's not. Like, I have to sort of give this sort of pill to some of our faculty members because they think that once, they see the light that, policymakers will sort of understand and change their minds and all of that. But I think there just needs to be a little bit more recognition that there are very reasonable other factors that go into the policymaking process. And so it's the researchers that have to adjust. You know what I mean? Like I just don't think anything about the policymakers needs to change. You need to sort of meet their incentives.
Yeah, to just follow up with you, Evan, your organization's really right in the thick of helping policymakers at the state and regional levels to solve problems. How do you negotiate research questions with your clients? And I would imagine that at times there are gaps between client needs, researcher interests, and data availability. So do you have any examples of such gaps, and how do you address them?
Yeah, all the time. I will push back on the client language. We don't get funding from our government partners, so we get outside philanthropy for all of our projects. And so it's a co-equal partnership, and that I think is important to answer your question. The only people who are partnering with us are agencies that want to be working with us and who see some value in getting expertise from, UC researchers to be able to do the projects that we're going to do. We come to them with a pretty simple pitch. You're not going to pay any money. You might take some of your time, but basically we're going to try and answer the questions that matter to you. So let's start a conversation about that. It's pretty open-ended when we start a relationship with a new government partner, where it's like, what have you always wanted to learn about? What have you wanted to understand from your own data? Or maybe like just think of blue sky for a minute, and what have you wanted to understand that you don't have data on, that maybe another agency has data on? I run this program, but I've never been able to link it to, workforce outcomes. So I don't really know if anyone's succeeding or if they're getting out of poverty. Well, maybe we can help with that, right? So it's pretty open-ended. I think once a relationship evolves with our government partners, it becomes a lot more projects coming from all sides. So we frequently will have a faculty member approach us. They have an idea for a project. If we have an existing relationship with an agency, we'll pitch it to the agency, and the agency might say yes. And if we work with them for 2 or 3 years, we have a trusting relationship. They might approve the project, even if they're not very interested in the outcomes of the project. Maybe it's interesting to some other agency in some other department, right? So it depends, right? It depends a lot on the partnerships that we have. But I would say that it's almost universally the case that if the project comes from the agency, or if the project idea comes from a faculty member, or even a Ph.D. student, it's almost always changed as a result of the conversations that we have. Like, nothing sort of survives the process of talking through what the project ought to be. It always comes out something different on the other side. And frequently there are these sort of Frankenstein things where it's like, we're going to be doing this project that has a piece of it that the policymaker really wants to know and has a piece of it that the researcher finds interesting. Because researchers, they only want to sort of know what's new, what's going to be new for the academy. And that may not be interesting at all to the to the policymaker, but the policymaker really wants to know, oh, did this program work, right? And so we often have to craft projects that can accomplish both of those aims.
Mm-hmm. Okay. Given that you don't receive funding directly from agencies, does your ability to negotiate in that way depend on having funding sources that are sort of not project-specific? Do you have open-ended funding sources? And what are the implications for researchers more generally who might not enjoy such an environment?
Yeah, I mean, anyone who's in the game of trying to find funding knows that our beloved foundation partners are not prone to giving out a lot of general operating funding support. They love projects, and so, I would say, 80% of the funding that we get is project specific. We do have some general operating grants, some foundations who understand what the Policy Lab does, really likes the model, and just funds us from a general operating perspective. But candidly, what we often do with our projects is we start the conversation about the project. We may even sort of start the beginning pieces of the project before we go and find funding for it. And what we find, I was mentioning this to somebody at lunch, maybe it was you actually, is that, from a foundation's perspective, we've got everything that they want, right? We have the data's already in place, the feasibility is taken care of, we have the policy impact story because we're doing it in partnership with government. And so that ends up being, we sort of take a risk on things, but we end up being able to fund them because it tends to be the kind of formula that foundations really like to see. And maybe you should chime in on whether that's the case.
Yeah, absolutely. Yeah, I'm happy to address it directly. No, you're right. And foundations don't like to give a lot of general operating costs. I was an executive director of a nonprofit for 3 years during the pandemic, which was quite exciting. Fundraised so hard for everything we did. And to your point, you really, you sort of have to come with a package to the foundation and sell it and try and talk to them about the alignment with their mission and their goals and all of the things that they're already funding and talk about the impact. And it's really hard. So I'm glad that you've kind of cracked the code on that. I think that's great advice, that you've created these partnerships, as you said, have taken a little bit of a risk, and it pays off at the back end. I think that's an awesome model.
And we're looking for general operating funders also. So,
and I will say, you'll hear in
wouldn't
philanthropy,
turn it
so I've been getting to work for many different sectors, and learning about the philanthropic sector has been fascinating. There's a whole sector out there. You've seen one foundation, we all operate a little differently, we're funded a little differently. Some are regional based, some are national, some are state. Really, it's just a fascinating sector. So
we're going to dig into that a little bit more in a moment. But Amy, did you have a comment? And then Tani.
Yeah, we're thinking through the kind of partnerships between scientists and government and policymakers, but I wanted to introduce kind of like a third partner in this, which is communities, because ultimately communities and people in the state are the ones that all of this is kind of for, right? We're trying to help people in the state, especially people who are most affected by health burdens, poverty, pollution, in our case. And so a kind of model that we're increasingly using at OEHA is that we'll partner with academics, we'll contract with academics, as well as like a nonprofit or a community group, so that research that we're doing is co-developed and crafted with the community's needs and that end result in mind. And then they're working with us kind of throughout the process of doing the research. and can, do things that we wouldn't be able to. Like they're already, engaged with the broader people that they serve. So they're trusted messengers. That's allowed us, for example, in a program to improve our pesticide education outreach for farm workers, to partner with local groups of promotoras who will do surveys of people who are farm workers, not working in either Spanish or English, but Mexican indigenous languages or Hmong, to understand how are they getting their information about health, about pesticides, who are they turning to, and then that in turn, that partnership allows us to be so much more effective in disseminating and partnering with community groups in a way that actually meets their needs.
I was just going to speak to the issue of funding research. So my experience has been that if you are an advocate and you have a message to deliver and you're going to write a report in such a way that there's funding for that. There are organizations that will fund you or partially fund you for that kind of advocacy. But when you are nonpartisan and you are writing a report that is based on the facts, however the facts may fall, where you don't even really know necessarily the outcome as you write, that getting funding for that kind of report is almost near impossible, even before the current narrative we have going on now with the elimination of so many different research sites, data sites, research groups, and such that, and maybe you're going to get to this, but it's that philanthropy has been thinking very differently in the last year or so. Let me call, we're in October, 10 months. In the last 10 months, philanthropy is thinking very differently about how they now grant funding to nonprofits or to even advocates. Because when I've talked to funders, their discussion is, we're holding back because we wonder if we need to go back to basics and start to fund boots on the ground, which we thought we had covered. So we have to do hand-to-mouth, boots-on-the-ground research first before we can even really begin to do policy research. And my rebuttal is, but policy research raises all boats. It is not a one-off, not one community, but everyone. But it is a push and pull. It's a very different time in philanthropy now. It's a very different time in grant funding. We say in nonprofits, have you been doged? And all of us have been doged. And even if your funds have not been cut off, you get regular intervals of inquiry about your work and a lot of questions about your website and a lot of questions about just how you are constituted. So there's a heightened sense of trying to be effective and funded and also just not being able to continue that because reports are oftentimes years long in the making. So it's a very different environment now, I think, for research as nonpartisan, independent research. And we're still navigating that, but it is a changed environment for certain.
All right, well, I got to say, today I've learned 3 new Greek words. What was it? Logos, pathos, and ethos, and 1 new verb, doged. So thanks for that. Katie, we're...
Also from the Greek.
Yeah. Katie, you work for a foundation, and so we're going to take a bit of advantage of you here. Can you pull back the curtain a little bit on how foundations select themes to pursue? I know you just said if you've seen one foundation, you've seen one foundation, but some generalities and then maybe moving to specifics at CHCF. How do foundations select the themes that they pursue, and how do they identify talent? How do you decide not just the what, but also the who?
Yeah, wow, that's a big question. And as I did say, when you've seen one foundation, you've seen one foundation. I mean, I've networked with colleagues all across the U.S., and we sort of start with, how are you constituted, right? Are you a 501c3 private foundation? Are you just a regular 501c3? Are you a 501c4, which our foundation is a 501c4, but our bylaws say we have to act as a 501c3 private foundation with respect to lobbying. So I'm a 501c4, which could technically lobby. And our board, and I just want to call out Dr. Carolina Reyes over here. She's one of our board members and our former board chair. So she can jump in anytime and tell me I'm going the wrong direction here. Our board has made a decision at our founding to make sure that we were nonpartisan and did not lobby. And so it's very, as you said, it's very powerful when you get to go in and say, oh, we're not here to introduce a bill, or we're not here to lobby. And everyone sort of looks at you, they sort of cock their head a little bit and go, oh, they sort of process it, right? And then they laugh, right? So I would say, so everyone has these little teeny tiny changes. Or, when we start thinking about the direction of a foundation, some foundations are spun off from health plans. And so they actually can't be in the healthcare delivery system. They work more in public health, for example. So there are all these, I would love to give you a simple answer. In our foundation, we are policy focused, we are California focused, and we are delivery system focused, and we are low income Californian focused. So for us, that really drives the general arc of where our foundation is going. And then every year we go through a priority setting process. And so as you can imagine, as we're planning for our next year, our next fiscal year, HR1 and implementation is absolutely having an impact on that strategy. So we are influenced by outside forces, if you will, and we're also influenced by, I think what Tani just said, the impact of that on our grantees as well. And so even since we're a 501c4, we're not subject to a lot of the 501c3. You're probably not into this, but there's a lot going on at the federal level and lots of questions about your website and the word equity and things like that. We are actually fortunate in that we can have the word health equity. We can have health equity still on our website, and our leadership has made that specific commitment to keep it on our website because many of our grantees and partners cannot have that. So I would say we're influenced by many things, but we also have a process for setting our priorities. Other foundations, if they're family foundations, they might have been endowed by somebody with a lot of money, and they say, I want to put my dollars into behavioral health, public safety, and voting rights in this specific community. It can be that specific, so it really depends. And so if anyone has questions about California Healthcare Foundation specifically, or our other large California foundations, I'm happy to talk more specifically about those in particular, because I know something about those. But if you're seeking funding, go onto their website. It's everything Tani just talked about when she goes into a legislator's office. Do the same thing. Look at their leadership, look at their board, look at their priorities, look at their mission, look at their history, look at, if they have any strategy documents on there, look at that, and then tailor your proposals to align with that.
What fraction of the projects that you support are essentially cold proposals versus those that you solicit through prior relationships that you might have?
Yeah, that's a great question. We are definitely a foundation. We're 30 years old, and so we have a lot of relationships in the healthcare policy space in California, just like the environmental health space. They're small groups of people, and so we tend to do, I would say most of our research is solicited. So we have partnerships, or we specifically get recommendations and we go out and we solicit those proposals. Every now and then we'll do a request for proposal, and so we will do a call for research. For example, we're talking about data. The Department of Healthcare Access and Information has a really powerful tool called the Healthcare Payments Database. If you want to know what health plans and doctors and providers are paying, go on that website. I think someone mentioned it earlier. It's real hard to decipher, and there's a wealth of data in there. We put out a whole RFP soliciting, I think we're going to fund 5 projects. And so in that case, we did not select grantees. We actually wanted to see who was out there, and so that one was really open more towards researchers like yourselves. But I would say most of it is solicited in our case. Okay. And again, that's not necessarily the case with many other foundations. Everyone has a different process.
Okay, appreciate that. This question is really for any and all of the panelists. Obviously, there's been a lot of change in the way we, as consumers, receive information, the way information's transmitted. The media landscape has shifted enormously. This was alluded to earlier. I think Amy Barnhorst talked about successful use of Twitter, but what do you see as the role of the use of new media, the internet, community groups and the public in advancing evidence to policy translation?
I'll start and say, we're still cracking that nut, just to be honest. We are on every electronic, we're on the Twitter, right? We're on those kinds of things. But our work is primarily in the value of its research and writing. So honestly, our first target is the wonk. It is the pundit. We're not really Twitter material. We try, that's what I mean. But this is serious research and important topics, and most of it, honestly, are we being taped? Is a bummer. There's not a lot of good news out there, and so it's hard to put that in a tweet. So we have to, based on the message we have to really think about our target audience. So we're still pretty legacy driven. We feel proud that we have a QR code. We no longer hand you a bundle of brochures. We give you a sheet of QR codes. But we're learning how to do that. We're still working in the digital media market. But so our work is serious. It's bulky. It's important. It lives on. It's legacy research as well. If you want to look at the ARC or you want to look at a longitudinal study. So we're not built for that. But we keep trying to find a way to be that. I will say one thing we do is we've started to bring in high school young people and community college students, and we make our researchers who are not far from that, right? They're masters and PhDs, but their first job, we make them make their work digestible to present to these young people. And they're sometimes flabbergasted by the questions they get from these young people. It's good training for the researchers, and it's good for the young people. But the research is big and it's bulky, and we are trying to fit into that, but we're a work in progress, to be honest.
So I want to just redirect and sharpen the question a little bit. Your work is obviously ultimately directed at policymakers, but do you see the public as any sort of conduit through which that message can travel? And how important is it to influence the public at the same time that you're trying to directly influence policymakers?
Absolutely, Richard. We actually do a lot of public convenings for free. We bring people to lunch. We do a lot of events for free. We're allowed to do that just based on our ability with our endowment. So we are talking about bringing along the public, making the public a voice, having them participate, having them engage, because I believe that that's what policy leaders can listen to. They get the call, their constituents, they have their town halls. If they hear from an educated community about a particular issue that's in their community that we hope we've contributed to inform, it makes a difference.
Yeah, and just to build on that, I think we've found it again and again, whether it's policymaker interest or funder interest, getting the media interested first is often the most helpful way to get people knocking on our door, whoever those people are that we might want to. So I think getting traction within press outlets is that landscape has changed. I don't think I have anything original to say about it. I think everybody's said the things, which is we need to continue to think about audience. We need to continue to use new if people are communicating on new platforms, we need to be there. If people are using different types of media, getting their information from different sources, we have to be there in a way that makes sense there and not the way that we've always done things. So that's not original, but it's I think obvious. I will say that I bought a bike recently and never got any Twitter followers because of it, but I'm thinking about posting that. So keep an eye out for that on my Twitter.
We'll give you a follow. We'll give you a follow.
Yeah.
That's
Yeah, exactly.
Yeah, that's right. We want to get AWIHA out there. Like academic researchers, we're primarily scientific, and we absolutely don't want to be the ones throwing the research over the wall and be like, what happens on the other side? So we're working on we want to get AWIHA out there through speaking events, convenings, talking at universities, talking to our partner regulators, going to where communities are and meeting them kind of where they are, talking about our work, learning about what what they need. So we have a public engagement presence that's growing. We have a director who's very active, actively getting out there and talking. And then within OWIHA, I mean, I think our staff are really kind of fired up about this. Like, they are scientists who came to work for public service. And so they want to see that science have those impacts. And so we actually have a communication work group within OWIHA that is training scientists on communication, that has scientists actually producing some of our communication materials and working on social media, right? So it's kind of both and, where we have professional communicators, but also are always investing in our staff and leveling up their ability to communicate. Because scientists, I think this morning it was said that the trust in scientists has kind of been going down, still very high. So when we have media inquiries, what I like to do is work with our expert staff to help prepare them so that they can be, our scientists, our best spokespeople for the work that we do. Most people not getting their news now through traditional media. They're not pulling up New York Times to read the headlines. They're getting it through social media. Not even through X, surprisingly. They're spending more time on other platforms, TikTok, YouTube, but the media, as you were hearing from Evan, still very important in driving the conversation, still very important in driving that framing. And so, pieces in the media will often be picked up on social, right, where they are seen. And so for us, it's kind of an all of the above. We're working with media, we're using our social media platforms to get information out there, both for policymakers, kind of commenting on what's happening in our space, kind of using our directors speaking to those kinds of things, but also, actionable information for you and me, who might be trying to avoid harmful chemicals in our foods or in the products that we use. And so we have a couple different kind of strategic ways that we're using social media specifically as part of our communications toolkit.
We're not on the Twitter. Just not. I think, as Tani said, our audience are the health wonks and the providers and health plans and sort of the entities that participate in the delivery system. And so we're not on Twitter or on TikTok because, as our communications team has looked at it, we're focused on the LinkedIn sort of population, and that's sort of the audience that we play most in. And then we have sort of like traditional, it's strange to say traditional now, but we have email listservs and things like that, and we post, we do weekly blasts to our audience. And so I will say we are actively thinking about, should we be on those types of platforms? And we have a hypothesis, and I'm trying not to go further than this, but we have a hypothesis that things have changed since the pandemic. And we want to go ask questions about that. So we're starting with our Sacramento audience to really try and understand where, let's be honest, folks, where are you really getting your news? Are you getting it from the New York Times, or are you getting it from your Instagram feed in the morning? And so we're really trying to understand where we need to be. And then once you are in those places, you have to think about, how do you translate those really wonky subjects to that audience? We're experimenting with videos. We're trying, as you said, we haven't cracked that nut. We know that there's something there, and we're trying to dig into it. And really it's all, but I will go back to, it's all in the service of impact. It's all in the service of getting that data and that information out to the people who need to know about it. And so for us, every single grant that we put through our approval process, when we write, we have a whole internal, we have very process-based, we've got lots of processes, and so when we write up our grant to get it approved and go through our peer review processes, there's always a question on there about audience. So we're always thinking about, when we are using, when we think of our funds, we have an endowment, we're very fortunate that way, and so we think of this is like a public service, a public good, and so we want to make sure that when we're spending money on that research or on that project, it's going to have impact in the spaces in which we want it, and it's going to benefit Californians. So we're always thinking about that.
All right, bit of a lightning round question here. We've talked a lot about ways that researchers can become more savvy as they enter the research to policy process. Is there any need, any role, or any appetite for policymakers and their staffs to learn more about evidence? And if that's the case, what can we do about it? without seeming too arrogant.
Well, I'll just start because we are always trying to do the primer, right? So we have just finished a Water 101, right? Because water is such a vast subject in California, under, over, ag, urban, metro, all of it. And it's so vast, and we have experts who will be so granular about it. I ask the question, do we need to be this subatomic? And they insist, because they're researchers, and it is good stuff, and someone is using it. But for a policymaker, I think, yes, I think they need to have, and it's almost by way of assuming facts and evidence, assuming they already know it, not being pedantic and trying to teach to them, because they're busy. For I know they do know it. They just are in a rush. They have so many issues on their plate. So I think that we try to create opportunities, group opportunities, but small group opportunities. Like we meet with the caucuses, we meet with the staff, we meet with the fellows, and we give them primers and we give them resources. Because we don't expect to boil the ocean. We don't think we're going to get everybody all at once, but we believe that when there's a need, they'll get it and will come to mind. So we try to make this information available, accessible, and we talk about how it is evidence-based. So every legislator I've met, and I've met every single new one since the last election, there's like 40 of them, everyone says to me, oh, I love data. And I'm thinking, great, can you give it to us? Yeah. But that sort of tells me that there is a mindset in the legislature that they are looking for that evidence-based information, and they want it. Do they have time for it? I don't know. But I think there's a desire for it.
Yeah, I totally agree. Every policymaker I talk to, members, committee staff member, they're curious, they're interested in learning, they want more data, they want more evidence, et cetera, et cetera. You know, when someone comes to your ice cream shop and you don't have the flavor that, like, you can't blame the person who's buying that you aren't giving them what they want, right? Like, so the problem, again, I'm repeating what I said earlier, but I don't think the problem is with policymakers. I think you have to take them as they are, and you have to help get them what you think that they could help them. So I think there's, the legislative staff, Policy Institute probably could do more segments on research and evidence. I think there's things that could happen, but a lot of the folks that we interact with, whether they're members or ledge staff, they might be trained as biologists. They might be trained as, scientists in some fashion. They're curious. They want to learn more. They might be doctors, right? Like, so I think that the demand is there, and we just have to give them the supply. Sorry, speaking like an economist.
Other thoughts?
Just one more thing. Actually, Evan, you said this earlier. There are a lot of factors that go into policy decisions. And so I know when we're talking about data, I think we're all assuming today we're talking about numbers and facts. But there are a lot of different facts, right? There's quantitative data, there's qualitative data, there's stories. And all of that goes into a policy-making decision. And as Amy said, you might have 30 seconds, right? One line to convey all of that into this. And so I just encourage you, I know we're talking about sort of academic or science data. There's all sorts of other data points that are going into this. And so I do think it's helpful to remind yourself that when you do go into a policymaker's office, they're getting data from a whole bunch of different sources, and they're getting it from nonpartisan sources, but they're also getting it from sources that have a reason to be giving the data and are provide, when we say lobbyists can mean a lot of different things. And so I go back to my experience in the Senate Appropriations Committee, and that was really where you decided whether a bill lived or died. And you would sit there and you had to brief the chair on this bill, and they would look at you and you're like, I'm the numbers person. It's appropriations, right? But I had to know the policy, the politics, and the numbers. And you have to be able to convey that and really, and the personal stories, right? And how it's going to impact people. And so that's all the data that is going into these types of decisions every single time. And so the data that you all are bringing is a really important part of that. And so I think, as Evan's talking about the different types of partnerships that he's bringing together, bringing that data as part of a partnership is also really powerful to get as many aspects of that together so you can push that policy forward.
please. Dr. Pan.
Former policymaker. So the issue. So I agree. Like all my colleagues and I, we want more data. There are some people. So what's your role in actually pushing back against disinformation? So it's great to say, people are all hungry for information, but there are some entities that actively push disinformation, things that are actually not true. And you said, let's give everyone the bottom line, but the bottom line doesn't explain, why is what I'm saying any more accurate than what someone else is saying, Children's Health Defense or someone like that. Can you address that, the role that you have in addressing disinformation, including the stuff that's on social media, by the way, that we're talking about?
I'm happy to start. Well, I mentioned there's training for ledge staff, and I think and there's training for new members too, and I think training them to be good consumers of research is an important piece. I'm otherwise incredibly pessimistic about the issue that you bring forward, and I don't have good answers to it, but I think the one thing that you can do is train people to sort of understand, at least ask the question about methods, even if they don't want it at the top of the paper, at least ask a little bit about that and try and be a good consumer.
There are some things that we do, in the media, if there are news stories that are reporting something inaccurately, that's in our issue area, something about our programs or something about our science that they're reporting inaccurately, then, we will reach out to them and request a correction. Sometimes people will respond to us on social media, and every once in a while we'll kind of reach out and either to them as a DM or we'll respond to kind of correct the record. Some of you might follow the governor's office on social media, and they've been very, very active with very rapidly responding to inaccurate information that others have been putting out on social media. So I think there is a role in kind of trying to make sure the information out there is as high quality as possible. Part of our role is also to provide sort of authoritative reports or authoritative assessments so that in this world where there is a lot of uncertainty, we have kind of authoritative sources that can be pointed to that lay out the evidence, what's known, what's not known, and in that way, I think kind of a step back, but we're equipping people who are out there and communicating about the science or making policy to counter that misinformation, because it can be really hard to do. Sometimes it's very obvious, but sometimes it's less obvious because there's, it's a wide and complex body of scientific literature, and so having those more, authoritative, reports can help, again, create the heft to push back against that information.
Can I also just add that I think that we can't do anything about misinformation, and as a nonprofit, and nonpartisan, and we don't rebut. But if that's why we want to be that source where you might ask about something. And if you asked us, for an example, about what this information is, and if we had it, we would tell you the contrary facts. Would we push back? And only in our subject area. We just only have 7 areas. We're expert in those areas. And we can tell you about misinformation or wrong information in that area if you ask us. If we see it circulate in the media, we might do a blog. We might do a fact sheet that counters it. But we're not advocates in the sense that we get out there and tell everybody this is misinformation. We're kind of waiting to be asked. We'll answer it if we get asked.
All right, well, you've been a great panel. We also have a great audience, so let's get some questions from out there.
Yeah, thank you. Very interesting discussion. But I feel like there's an elephant in the room, which is that the federal government is sort of consuming all the oxygen with respect to health policy in the United States right now. And so I'm curious how, in each of your roles, you're trying to engage at this intersection between state health policy and federal health policy to kind of obviously mitigate the impact of what the current administration is trying to do, or perhaps to inform the current administration. So I've talked to others who say that they're working on connections, inside the Department of Health and Human Services. So I'm curious, are there opportunities, even in what seems like an evidence-hostile environment currently, are there opportunities to leverage the resources that we have to try to influence federal health policy?
I'm happy to jump in here. I would say yes, there are absolutely opportunities, and frankly, many organizations, philanthropy, our partners, grantees, state governments, we've all been working on this since for, what did you say, 10 months? 10 months. And I'll just speak for my organization. We started with, I think of this as sort of like a 4-year campaign, right? This is the federal administration we're working with for the next 4 years. We're a California-based foundation, and so the federal government is absolutely now an outsized influence on what's happening in California. And so we have, I would say, reinvested in our, advocate partners. We called it During Defense, so prior sort of January through July of this past year, we provided grants for communications to get data out into impacted communities. We worked with the UC Berkeley Labor Center, as did many of our other partners, to feed the same data and information into communities and into policymakers so we could really talk about the impact that these proposals would have. Once the bill was, we also funded a convening of our entire California delivery system, where we brought together people who don't usually talk to each other, consumer advocates, health plans, labor, all together in the same room to point everybody in the same direction and help them share across those lines. So we really tried to convene that as well. Now that that bill is passed, we're absolutely in sort of mitigation mode, as are many other people. And so there's sort of like what's happening in the next 18 months. And then as, how we're providing grants to our state partners